Prostate cancer claims the lives of more than 30,000 men every year in the United States. More than 240,000 men are diagnosed with the disease each year. For the first time in more than half a century, there are new treatments available. But surviving prostate cancer begins with a test that has been the source of controversy.
There are hundreds of men in Oklahoma who have prostate cancer and do not know it, a disease that is the second leading cause of death among men. For many, a cancer that is low grade and never really causes harm. For others, it's deadly.
Prostate cancer has a long latency period, or it can actually take years to sort of affect the life of a person. You want to make sure that the people that you're targeting have at least a 10-year life expectancy, and also you look at their overall health to determine if that's likely.
Dr. Michael Cookson is chairman of the urology department at the OU College of Medicine. He says for all men, finding out for sure begins with a PSA test.
About when to test, who to test. Currently, it's thought that probably the age range around 55 to 69 is 55 to 69 years of age without a family history.
Dr. Cookson says there is a group of men that fall into the high-risk category for prostate cancer.
African Americans and patients with family history, brother, uncle, father, those patients are at increased risk, and they're probably going to be recommended to have a screening maybe at age 45.
The PSA test is a blood test, but it's not specific for cancer, and it can produce false positives, so a physical exam is necessary.
Then the next step, if you took it, would be to undergo a prostate biopsy, because currently, even though blood tests may suggest you have it, only tissue can confirm the diagnosis.
And if cancer is found, Dr. Cookson recommends a second opinion because he says things can get very complicated.
Or active surveillance is an option for many men. Treatments, and the treatments usually fall into surgery or radiation therapy. Even radiation has proton beam, external beam, seed implant, or brachytherapy. The surgery can be performed conventionally through an open operation, or more commonly these days we do small incisions and robotic surgery.
The challenge for the doctor is to determine what kind of treatment is necessary to eradicate the cancer without impacting the rest of the patient's life in a negative way. Dr. Cookson says it's important for men to understand the options and consequences of all the treatments. So why not treat every man found to have prostate cancer?
The prostate is in a location that has significant potential negative consequences for your quality of life. Control of urination, sexual function, those things are all intimately involved with the prostate.
For the first time in more than 50 years, doctors do have some new options for treatment of prostate cancer, and one they call the Holy Grail.
We're also starting to incorporate some genetic testing into it. While none of that has really reached that high bar of level of evidence, people are starting to think, okay, with this piece of tissue, I might be able to predict even from a molecular basis what's more likely to happen with this cancer as I go forward.
And there are a number of new medications doctors can now use as well.
In the last couple of years, 6 new drugs have been developed, or treatments for advanced prostate cancer, that have demonstrated survival advantage. So all of them move the needle 3 months to 6 months in the life of an advanced prostate cancer patient.
Some drugs are for chemotherapies, some work on testosterone receptors, and others address the immune system or lower even further testosterone levels. The new guidelines that Dr. Cookson helped to develop now call for all men between 55 and 69 to be tested, because if prostate cancer spreads, it cannot be cured, and the treatment options can be difficult to live with.